Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Good morning once again. Welcome to a Chat of Uganda Family TV. And now, Issues at Hand here for us to digest on matters concerning in our environment, but particularly today we're going to be discussing issues to do with our medical interns in various hospitals across the country. But specifically, you know, always we are sponsored by Protea Hotel by Marriott in Entebbe, a very nice place, a very beautiful place to be in. In case you have a guest who is trying to fly in, make sure they don't bypass Protea Hotel by Marriott in Entebbe, because they have very outstanding services, be it accommodation, be it the meals, be it the gym, spa, and all that. Everything is up there to the game. So please, you can find time and use the contacts that are there on the screens, of course, to book your stay at Protea Hotel by Marriott in Entebbe. Yes, today we are going to be discussing issues to do with the current dilemmas of the medical interns. Remember, some time back, I think it is 2022 or 2021, the president came out and gave a directive to increase the allowances of the medical interns from, I think, 750 Ugandan shillings to 2.5 million Ugandan shillings as their allowance. But this directive was not implemented, and of course we have seen them for so many times coming out to cry out to the government to do this, to have this directive implemented. But of course, up to now, it has not yet really been implemented. And then yesterday, we had the Ministry of Finance release around 4.974 trillion for the third quarter of the financial year 2023-2024. And when the permanent secretary was asked, he said there is no room yet for the medical interns increment, because apparently the money has already been released, unless if that can happen is by borrowing or getting loans, which is not something he thought is going to be functional in a near time. So but of course I'm blessed to have of course the Treasurer General from the Federation for Uganda Medical Interns, which is FUMI, and of course he's called Dr. Oscar Melvin. It is a pleasure to have you here.
Thank you so much.
Yes, you can greet the people.
Good morning. I'm happy to be here, and I greet out the listeners. A simple introduction. I'm called Dr. Oscar Melvin, and I'm the Treasurer General for Federation for Uganda Medical Interns, FUMI, and I'm here to inform the public on the current status, or the status quo about the medical interns. Thank you.
Okay, that is interesting. So maybe you can first take us through where all this comes from. What is the status currently? Okay,
thank you so much, my host. So currently what we're having on ground is there is a breach in the presidential directive PO3 that was released on 9th of August 2021 by the president concerning the issues of allowance of medical interns. Maybe one thing I want to clarify is interns are not paid salaries.
Oh yeah, sure.
It's just a stipend or an allowance that covers accommodation, it covers meals, it covers rent. Reason being that these medical interns on their sites we work 24/7, and you don't have time to go and maybe hustle side to sustain yourself in the day-to-day running. Maybe specifically, most people don't know who are medical interns. Medical interns, these are trained graduates. We have graduated, we have our papers from our institutions, medical training institutions, and we're only going under one year training or rehearsing with our seniors to get a license.
Oh, okay.
So I can opt not to do clinical work and go and do outside work, social work, without going an internship.
Okay.
But if I want to do clinical work, I have to go undergo training, or this mandatory training. And for information, it's within the constitution that the government is mandated to have these people trained under their facilitation. It was passed by the Ugandan Dental Practitioners Act of 1998, Nurses and Midwives Act of 1996, and also by the Pharmacist and Drug Act of 2021. That it's the role of the government to make sure these interns, these fresh graduates from school, they undergo the mandatory one training, and they receive that hands-on. At the end, they get licenses. And for information, it's also under the J5 Act, under the Public Standing Order, that all interns who are going under apprenticeship, that is payable, should be paid. And so we are backed up by the Constitution. It's a legal entity that we are supposed to receive allowance. Now, the issues of medical interns traced way back in 2017. There was a stipend on allowance of 750. That's where we started from.
Okay.
We are doing training, but with a 24-hour, 7 calls. It was training so much to give quality care. And we had a lot of issues coming up. One of them including we had straining of the medical workers is under training, staying in very far places.
Okay.
I can give you an example.
Which means for accommodation, you're not catered for. You're not catered for.
We don't have we are currently deployed in 58 sites or 58 hospitals across the country.
Okay.
This includes the national referral hospitals, the likes of Mulago, Kawempe, Chirudu, and we also cover the all regional referral hospitals in this country. We cover district hospitals in this country, some district hospitals, and we cover also private and for-profit hospitals in this country. And with the current statistics, medical interns provide 60% of this work task force in the Health Uganda, in all these hospitals. And when you add in SHOs, senior health officers, we cover up to 80%. So you understand the work task force that we are giving. And on the day-to-day duty is we are the first line people on that. We are the first liners. If we are in the war, you know what it means to be on the first line. We are the first line people on the task force. So if I give an example of Mulago, if you go right now to emergency department for Mulago, you'll find there 4 to 6 interns, and with a ratio of 1 or 2 the staffs who are employed by the government. So you understand the amount that we cover. So from then, we had a lot of issues. Our colleagues were being raped. We had one case. It happened also in Kabale, way back in 2018.
Raped in
because
the
of
where they stay.
Yes, you stay because most around these hospitals is very expensive. A clean and well secure house in around Malawi, you have to pay 300 or 300. So we opt to be far away in ghettos which are cheaper for the pocket that you have. And in the so doing, we've had a lot of cases of theft. We had a lot of cases of...
So the government does not provide accommodation?
It doesn't provide accommodation in most of the facilities. Though there are some facilities that have accommodation, but they don't cater. I'll use same the case example of Mulago. Mulago has over 200 interns. They don't accommodate all of them. They're accommodating half of them. So around 58, you find there are only 20 sites, and 20 sites find they're covering at 20%. They don't receive meals, they don't receive transport, they don't receive accommodation. So you're basically weighing on that. And if we had time, maybe that people have extra time to work out, that would be better. But you're on duty. Like my current site, I wake up at 8, I leave duty at 5. Sometimes I have the night duty. I cover the night duty from 8 p.m. up to 8 a.m. in the morning. Then I come again for a day duty from 8 up to again 5. That is 36-hour call. The time I have one off, I'm down to rest. That's the day routine for throughout 1 year. So after a lot of consultation with the president of all issues that I might not mention and finish, 2017, there was a request for dialogues to have this issue handled. However, the dialogues did not yield. 2017, 2018, 2019, there were industry actions now because the indoor dialogues could not work. 2017, 2019, 2021, it was full of negotiations and on this issue. And we reached an extent that there was an agreement with the leadership of the Federation for Uganda Medical Interns and Uganda Medical Association and all associations, all bodies that govern medical professions. They sat with the president and agreed that this task force provides a basic health care and should be supported to do its work. And it was agreed with His Excellency, Yoweri Kaguta Museveni, the president of this country, that in his saying, he said that every medical intern should and must get the halfway of their seniors. As simple as that. And it was written on 9th of August 2021 and he released the press and his statement that people should receive that allowance to continue doing their works. And it was implemented only in the cohorts of 2021, 2022. 2021, 2022. That's why we got interns who were under training getting that allowance. And we are so okay, jubilating, giving out our best. Not until last year, in 2023, when it reached time for deployment of the medical interns, that there was a lot of delays, and we were told there's a revision in this. But as the stakeholders because we are the people affected, we are not told, we are not involved in any of this. We had a lot of writings, requests to be informed about what is happening. There was a lot of tensions, a lot of stress. Currently, me, I trained for 7 years. I started my university in 2017. And I happened to be in a private institution. I finished in 2021 when put in COVID. We sat down to calculate the amount that I spent in a medical school. It's over 100 million.
Wow.
And from that, we had a delay in the deployment. And with consultations, we had a lot of consultations with the Minister of Finance. We wrote to several people, the President, Office of the President, the Minister of Health, on this issue. But we are sidelined totally. Then on, it was in 27th of July, when we got a press statement or a press release from the Minister of Health saying they have deployed medical interns. We were down for almost 4 to 5 months waiting. And they will receive a net pay of 1 million and go to sites. No question. And we are operating in a country which follows the rule of law. we went to sites, and as the leadership of the federation, we wanted to inquire and know what is going on. Who has the authority in this country to breach the presidential directive? We know the Fountain of Honor is the last person that we will not reject his directives.
Sure.
So we have, ever since we started internship.
So who was directed to do this? Is it the Ministry of Health? Is it the Prime Minister? Or who?
So in
what exact office was?
In his writing, in 2021, he wrote directing the Prime Minister to work on this issue, of which was later worked on. And then he released a letter directing the Ministry of Finance and Ministry of Health to allocate that money, of which was done, and things moved on. Now, but to our dismay, in this current status, on 1 million, we've had the same issues that we had last time coming back. It is very unfortunate a parent invests 100 million in their child in becoming a doctor, and then they succumb during internship. We've had issues in Kabale, for example. Our interns at Kabale Hospital, Regional Referral Hospital. As the area issues why internship allowance was increased, to facilitate people to safety areas. We have 3 cases, they are even open, they even reported. We have 3 cases where interns they broke into their rooms where they sleep. 2 of them were found sleeping. Sleeping, they took things. It was to God's mercy that none of them was hurt. This is an indicator that things which had been worked on and sorted, because as a country we are moving forward. Yes. We are moving forward, we're not moving back. And then in the same last year, we had one intern who is practicing at Chudu, was attacked on the way because of a long distance.
Okay.
So there is issues that we've come up, we've asked why there is why the presidential directive is not being followed. And for the last 3 to 6 months, we've tried to inquire and to ask to be given a platform, and also to reinstate, because this is the presidential directive that has to be followed. Currently, in the parliamentary report that was released in May 2023 about the same issues, the Parliament recommended that medical interns should be paid according to the presidential directive, but it was not followed. So we came up in November last year and communicated to relevant authorities and told them this and this, we need this worked upon and this. If not next year, in January, we shall put down our tools in reinstate the presidential directive as he directed it. We would like to thank His Excellency the President of Uganda, Yoweri Kaguta Museveni, for his venture to support the science world. If you look at this world, if you look at the fastest growing countries or the fastest growing nations, technology and science is what is taking them. As others are going to moon, as others are in robotic science, for us we are fighting for a tipping of medical interns who are providing 60% of the health care.
Now, let me ask Dr. Oscar about this particular demand. Are you, because in the public, you seem to be like you're demanding because it was a directive. Are you demanding because it is a directive, or you're demanding because you are doing something else there?
Okay, thank you for that. Maybe also to make a clarity, we are not demanding for an increase. That is what I wish the public to know.
Okay.
We are not demanding for an increase. We are requesting that, requesting and demanding that what was previously paid should be paid. I've not seen in any other sector in the public health or in the public service where they reduce allowances or where they raise people's salaries. I've not seen it. But it's only here that us who provide the 60% of the work. It's like a military training. But you can't support them out of the entire budget. It's the population that you have to target. When we talk 60% of the Ugandan population, I mean 60% of the service that we give, this is a common peasant, this is a middle status. Even the first class, we serve them. If you go to the medical emergency, we had last month one of the greatest preachers in this country was first handed by a medical intern when there was a shooting, something like that. Well, the people received him at emergency in Mulago. So every person goes into our hands. So we don't want the public to look at us as if we are hungry or what. But we are serving in a critical care. You know?
Okay.
And we respectfully say that these issues that affect the normal person, the common person, should be handled critically and put forward in this regard.
Okay. So about the interns, maybe if we go back a little bit, is it mandatory for every medical graduate to go for these particular internships, and is it also supposed to be the government paying you, or can't you go to a private hospital and then you do that on your own?
Thank you so much. As I earlier said, when there's a difference, I think, in medical training with other departments or other interns. For our case, when you finish the 5 years in any accredited medical institution, you're given your certificate, documentation at that university. Now that shows you clearly studied 5 years, you underwent training, passed examinations, you're fully accredited. Now we have the end or the part of clinical work. Now this is mandatory for any medical profession who wants to practice clinical work. Clinical work, this involves interaction with patient, inpatient treatment, inpatient treatment, diagnosis, examination, and so on. You have to go a mandatory 1 year medical apprenticeship or medical internship under the Ministry of Health. It is mandated, as Arya said, as requirements. Like internship is a requirement stipulated under the Medical and Dental Practitioners Act of 1998. That one is in the Article 272, and the Nurses and Midwives Act in Article 274 in 1996. That was passed in 1996, and in Pharmacy and Drug Act, article that was passed in 1970, Article 280. And it's clearly mandates. It's a mandate of the government to make sure these professions undergo one training, undergo one year training under the supervision of the consultants.
Okay.
So if I can give a clear example, if I am working in a ward, let's say maybe a surgical ward. We are handling a surgical patient who has been operated. We are dealing in the day-to-day running of their health improvement. Any issue that is above us, we consult. If I can give you an example, maybe in an emergency department, I may want to use the case study for Mulago. You are the first contact. you receive, you stabilize the patient. If it has been an accident, if it has been a bullet shot, you resuscitate the patient to stability until you have to run to theater with your consultant.
Okay.
So it's throughout that 1 year, that at the end of 1 year, we are assessed and affirmed with our clinical skills and licensed to serve Ugandans.
Okay.
But the difference part is when we are undergoing medical internship, is it's not like these other internship. You work, you operate. There are cases which we do operate under our supervision of our seniors. The mother deliveries, the emergencies, and these emergencies, I mean pediatric emergencies, medical emergencies. We have surgical emergencies, obstetric emergencies. We handle almost 80 to 90% of these emergencies in this country.
Really?
Yes. And as the Federation, in August, when we were deployed in August, we did a study. I think I will share the results. We did a study from 58 internship sites to assess the improvement in the service from the time we reached into the sites. And there was 50% increase in the waiting hours for the patients from the 2 months we had been deployed. We did it after 2 months. And there was also improvement in patient admission discharge time. And in most facilities where there was reduction in mortalities. I'm giving you an example in Mulago. Mulago emergency can receive over 100 patients in a day. And you have one medical officer, only two medical officers, because their employment is, if under an emergency, they have around 2 to 3 who work there in those shifts. But medical interns, you find they're around 8 to 15. So you can compare the amount of work that is covered by 8 to 15 people compared to 3 to 4. So if you're able to receive, God forbid, maybe an accident that involves 30 people, and you have 3 medical officers that are there without the presence of interns, you cannot serve all those people at the same time. So you understand the work task force or the manpower of all those people and the contribution. And I think as a country, benefits a lot in this work task force. Because if I have currently medical doctors, those who are on payment, they get up to 5.4 millions. If I need the facility to run, and I'm able to supplement up to medical interns giving me 60%, I think I would have saved much than employing all other qualified doctors or qualified medical profession. And I use these people to provide the service. So as a country, we save billions and billions of money.
All right. Of course, and when the treasurer talks about money, yes, it is really important to note what they really go through and what their health or what their well-being is in regards to the time of the training. Yes, we're still discussing the dilemmas in the medical interns situation currently in Uganda, because when we return, we're going to be talking about when they plan to lay down and why. So stay on.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives. This is Church of Uganda Family TV, enriching lives. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Welcome back. You're still watching Issues at Hand here at Church of Uganda Family TV. And yes, do not forget that we are powered by Protea Hotel by Marriott in Entebbe. Of course, as I always mention, a place you'd want to go and check out because of their fantastic services they do offer. We are discussing issues to do with the dilemma of the medical interns, the situation of the medical interns, and of course you saw how Dr. Oscar Melvin took us through what they have been going through as interns and what it needs for them to have a good life where they do this voluntary work of helping their superiors in terms of this hospital, but also as they also gain experience and training here, because later on, yes, as he told us, they are awarded a certificate, which is very, very very important to have as medical personnel in society. So here, this particular segment, I want us to focus on the day when you want to lay down tools, and specifically yesterday, the Ministry of Finance, I don't know if you heard, they released the third quarter of about 4.973 something like that trillion Ugandan shillings. And of course, you were not included. I don't know what this means to you people. And when the permanent secretary was asked about if there is a provision, if there could be a provision for the medical interns, he said currently in this the money that is being released, no, it's not there. And of course there are no finances, the country is in debt and all that. I don't know what this means to you, specifically the medical interns who wants to lay down tools.
Thank you so much, the host. And now on this issue, I listened to his address speaking on the absence of the money. You know, we live in this country, and specifically, if they are to pay our areas, we just need around 20 to 30 billion.
Oh.
20 to 30 billion on this to cover even what they have not been paying for areas as per presidential directive. 20 to 30 billion to 1,877 medical professionals, providing to 58 hospitals in this country. But there is no money. The other day you're going to hear one person has been given took out 21 billion for coffee. That is one person. But you can't manage to get 20 to 30 billion. The areas of these people as per presidential directive. Who is wrong, who is right? What are our priorities as a country? For us, we young people who have gone into this leadership regime. We've been taken up into this science field because there was a campaign by the president. We thank him for that. Me personally, I wanted to be a lawyer.
Oh.
But as I was growing up, I used to listen to the president's message about the need of the science in the country. And I found out after my Form 6 taking up to the side of the medical field, what are our priorities? Is it to fund the health care? Or it's to do other things? As a country, can we fail to allocate, even which doesn't make 0.1% of the budget to health care? What stipulates? And how do you get convinced that there is no money when out of the blue you're there struggling, serving? On a day you can see 50% on a day. 50 patients. But you can't support that task force because you don't have money. What are the priorities? What are our priorities at country? As young generation, what are you showing us? We are serving this country with our hearts. We spend a lot of time with sleepless nights. You're putting down, the emergency call is up. Spending almost half of our life serving the country. But we can't get a tiny part of the budget. That is what we think. If it is looked into, there will be a source.
Okay.
We can have reallocation of money from other sources, other finances, other departments, which you think is, but you support the Ugandans.
Okay. But have you thought somehow maybe it just came up in my mind, have you thought of maybe the hospital being responsible for you other than the government?
Now, the hospital is also under the government, under the Ministry of Health.
Yes.
And they receive everything from the Ministry of Health. The funding and the budgeting is from the government. Nay, they don't have authority. They don't have capacity. We're also working in underserved facilities. This is a facility, I know one of our such facilities I wouldn't wish to mention. They just received surprise in November.
Wow.
And we are there working. You receive a patient full of blood. You can't have enough gloves. It is a tough situation that we are serving in. But we are in there. Apart from that, but then you also can't sustain yourself. Because the current status you are serving doesn't facilitate you. It's only a tiny part of this country's budget.
So on 1st February 2024, you want to lay down tools?
Yes. And we are strongly saying this, yes.
What situation does this leave to the country, majorly to the health sector?
We think we have one of the listening leaders in this country, and they know what's going on.
We have seen teachers strike, and they just told them if they are not coming back, they leave. What if the same scenario happens to you? What happens?
We're a legal entity. If we are doing this illegally, then that's why we would be chased away.
Okay.
But we have the capacity, we have the legal team to protect us. Because we are legally doing the right thing. If we are demanding for an increase from what we had, that would not be the right time. But now we are saying, please, what was facilitating us to serve properly? One thing I want to tell you is the mental health of a medical profession is so vital to the service that they provide to the patient.
Oh, yes.
This is a person who is handling a mother. Is picking out the mother delivering. You're operating a mother. Bring out a young child who is tomorrow's president. You'd want to be in that sober mind. You don't want to be on a operating table when you're hungry. The results for our profession goes with the quality of the person is providing it. You would wish to mind the mental health. We've had a current surge in our profession of people having mental breakdown. We've lost also far 3 doctors. And they're all under training. And issues originate from this, what I'm talking about. You know? So we were saying that come 1st of February, we've had this duration that we announced since November. It's so quite unfortunate we're at a stage where in this country the negotiation yield less than instructions. And me as a professional healthcare worker, that is the last thing you want to do. Because much as I want to serve my population, much as I want to serve my patient, but you're so fast. At this young age, if I'm mentally broken down. I'm curbing the service I'm to provide for 30 to 40 years coming. You know? So it's what we are saying that come 1st of February, medical interns in 58 sites, including national referrals, regional referrals, we shall cease providing our services until this issue is addressed.
Okay.
We are pushing for something legal that the payment which we are getting was put for the reason. We thank His Excellency. He's a listening person. When he was told in 2021 about these issues, he clearly understood what is going on. And it was from his conscious mind that these people get half of their seniors as they are running these facilities. But we don't know what happened.
Maybe the country doesn't have money.
If it didn't have money, why do we get one money being taken by one person? At least if we didn't have money, if you don't have money, you always see the signs of there's no money, you know?
So how long do you estimate this? What if you're not responded so quickly? Are you going to continue until the issue is addressed?
I think our services, they are so evident. And any clearing leader, any clearing person in authority, you will not allow that to happen. Because there's no, you say 60% you're pulling out. So like how you can pull out the biggest supporters of the house, but you still want to stay in that house, it will fall down. You know? So we are saying responsible people, we shall put down tools until this is reinstated.
Okay.
And this is not only working for the future. I mean, for now, it's also working for the future.
Okay.
We've not seen, I also wish to comment about, in that budget planning, we don't see the planning for the next cohort. As of May 2023, in the parliamentary report that was released about medical interns, the parliament reported and recommended that there should be clear planning. This comes about with the training, the planning, so that you know that in this year I'm receiving this and this. And you're able to cater for them. Plan early. What's wrong with that? We have big people, we have big teams in planning section of this country, the Minister of Health, you know. And there's another thing I need to clarify about the numbers. There is a stipulated theory that there's an increased number of interns across the country. Me, if I was the person in leadership, I would be very proud of that. Because if I have a growing population with a growing medical trained professionals, that is a total asset. I was reading about Cuba. Cuba gets a bigger percentage of its income from importing medical workers. Have we thought as a country to have these young people out, if we can push out 1,000 or 1,000 per year, can we absorb maybe 80% and use the other rest as our importing new task force? Do you know how much money it would bring? The casual laborers that are sending out of the country are bringing a bigger percentage. What if we have export of health professionals? Have we thought about that as planners of this country? Other than start blaming now these young people, because during pre-internship, when we are ready to be deployed, the narrative that they were selling us is we are very many. And look, in 2019, the population was not as 2024. You expect every day the population is growing. Currently, the ratio of a doctor to patient health worker is still way far. 1 to 250,000, I mean to 1 to 225,000, you know. We are still way below, but we have the task force which we are not facilitating. So I think as a country, if there is adjustment, these are the issues we wouldn't be seeing coming up. I earlier told you countries are running into robotic science. But for us, we are even at a level where we cannot pay, where we cannot facilitate those providing the biggest percentage of our task force. What are our priorities as a country? So we take this call as the Federation for Uganda Medical Interns and request the government. We have written several times to Ministry of Health, either evident on our pages and whatever. We have never received any reply from them for that 6 months. What does that stipulate? And we are requesting the president of this country. We so much appreciate your vigor towards supporting the science world of this nation, but we request that he handles this.
So is this the first time you are doing this?
So as
laying down tools?
No.
And how different is it going to be?
According to the history of what has always been, it's only this language that they listen to.
Okay.
When you write, it's not understood. But when you make an alarm or putting down, I don't know, I clear as a person don't like this. I hate it totally with all my life. But I've come to learn that situation squeeze and fold you to do things that you're not supposed to do. If your person responsible can't listen to you with due respect, because you're all serving the same country. But only when you put down tools, that's when you announce a strike. It has been to our allowances even.
Okay.
It was agreed that even that 1 million be paid per month. But you receive it after threatening to strike. You know?
So maybe let me ask this. People out there, because I've been seeing what is trending on social media, what other people are thinking, what their thoughts are about this particular strike that this is yet to happen, or even previously when it used to happen. How different are you? Someone out there doesn't understand the difference between your internship and any other person's internship. So how different are you? So
I didn't want to compare, but I think I will have to inform the public. I think I don't know any other internship that is handling the health of the Ugandans. Is dealing with their health. I'm talking a scenario where you bring your woman. She has failed to deliver. I operate her within 1 hour. I give you life and I save the life. I don't know which internship is that. Then, I think it is totally different from others because of our work schedule. I don't know if there is any internship that they cover up to 24 hours, 36 hours. Someone who reports to work, works day, puts the next night, puts the next day, serving. I don't know if there is that internship. If there is any other internship that is that. And then we are clearly backed up by the law. As I told you, as of Public Standing Order 2021, which say that it provides that the interns who perform tasks for which allowance is payable shall be considered for such payment at the existence rates at the entry level of the post time. So it's a mandate by the government.
Okay.
It's the grading of the internship and the impact on you're doing. If as a country we're able to save maybe half of our budget, half of our payments in this, then why not give them something little?
Okay.
And they serve for it.
So how often have you engaged in, can I call them peaceful talks or what? How often do you engage the authorities, those who are responsible for what you are dealing with?
So we started deployment we're deployed to go to these sites on 3rd of August.
Okay.
On 3rd of August, and starting with the next month, September, that's when these discussions started.
Okay. But I'm looking at, I don't know if you call them cohorts or what, but every deployment, it seems every deployment every year is going to be having strikes.
Now,
How are you looking to address this?
now that should clearly state there is a problem. Because if we don't have a problem, they wouldn't be raising this. That clearly states there is a problem. Why is it every year there is something, industrial action, there is strike coming up? Is it these people are not sober? Has anyone thought about it? Why specifically is a problem coming up? One, we don't have an internship policy. Internship policy that is followed.
Okay.
There is a draft that was being formulated, but we don't know anything about it. As interns, we clearly don't know anything about it. It's how I can come and draft something which you're going to be entirely involved in, but I don't involve you. So we say they should formulate a policy that should be all people that are responsible, all stakeholders are involved, and they really reach a clear view on the policy that will guide. If it is a policy that is drafted under doors, these strikes will not end.
Okay.
If the interns complaining about allowances, it's so obvious that in these facilities we don't have accommodation. You're having a site having 50 people, but you're only having 10 people accommodated. But at the same time, you want him to be on the training site for 24 hours. Have you thought about their existence there? As they are providing, if they are not facilitating, or if they are not contributing to the services, you would. But these are people who are contributing the services, you know. So all these issues that are coming up, cohort by cohort by cohort, shows there is an existing problem that should be solved, you know. And it's one of these that all these issues were done, you know.
Okay, sure.
But now, down praying all that had been put on to solve things, it's again bringing issues again.
Okay, that's interesting. It is really a pleasure to have you. Our time is fast spent, and I wish you could give us some of your last remarks, maybe as we wind up.
So as we finish, I would wish to extend vote of thanks to 1,800 medical interns that are serving this population of Uganda with hard work. I applaud them that despite the challenge that we are in. And I also wish to thank the Ministry of Health for giving us opportunity to go undergo this training for our internship. We request them that let's have this worked upon. Let them listen to us. And in a special way, we thank His Excellency, the President of this country, the Commander-in-Chief, Yoweri Kaguta Museveni, for the love and the direction on the science world that he has exhibited for this long. We pray that this issue there are channels to put it under his table. We pray that he clearly listens to it, and we keep on. Our passion is to serve the health of the Ugandans as it's mandated in our training. I thank you all, and come 1st February, that is what is happening. We shall lay down our tools from these facilities, 58 of them, including national referrals, regional referrals, district hospitals that we work in, private non-profit, until this is addressed. And it's addressable, it's something easy to work on, and we move on. Thank you.
Thank you so much, Dr. Oscar Melvin, for your insightful discussion about what is happening in the situation regarding the interns or the medical interns who are currently opting for a strike or to lay down tools on the effective 1st of February, just a few hours from now. The medical interns will be laying down their tools. Where does that leave the health sector? It is a question for me and you to digest, and also of course, to the officials there in government to digest about that. We have seen money has been released, nothing has been catered for, put aside for the medical interns. Where does that still leave this particular sector? My name is Luke Majumba Naitwe, and we appreciate that you joined us through this discussion since 9, and now that we are ending, please do stay on. We have still interesting programs for the day, but for now we are wishing you a lovely day. But do not forget to check out at Protea Hotel by Marriott in Entebbe.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is